good day everyone. My name is Nurse Julia and I am going to have an interview here with my friends. But my friends are running late, so it's been a while since I have seen them and I really wanted to have a mental break talk with them since nursing has been rough lately. But I haven't seen them in a while, so have you seen my friends? Have you seen Jody? Oh, Jody! Oh, it's been a long time! Okay, so this is Nurse Jody. So she's here to have a talk with us. But have you seen Jella? Hi, Nurse Jella. It's been a long time. It's been a long time. So this is Nurse Jella. But guys, have you seen Nurse Gwen? Nurse Gwen! What's up, guys? It's been a privilege to be invited here on your podcast. Yeah, thank you so much for coming over, guys. I'm so delighted to see you guys here. I appreciate your presence for coming over. So I have called you over to have a small talk regarding about our profession. So how has nursing helped you throughout these years, Jody?
Nursing has really helped me to hone my skills, and I'm really grateful that I am in a field that I am passionate about, and also I could serve other people. So it's like hitting two birds with one stone. So I'm just really grateful for all the growth as well, and how I was able to portray the effective communication.
Wow, I'm so proud of you. Yeah, right.
It's been a long time.
Yeah, it's been really long.
Who would have thought?
Yeah, we are here now, right now. We are.
Yeah, but how about them? How about them?
How about you guys? How has nursing been through? How have you handled nursing in your life?
So far nursing has been great, and it has also helped me understand myself more, and also I think overall it helped me become a better person. So and I've been enjoying it a lot lately. So
damn right.
Damn.
So I'm going to start off the talk with a question about how does the role of communication affects or influences your profession now? Like how does the role of communication influence your work as a nurse?
So I'll start off with a comment. So I think it is very essential to consider how vital communication is, since every day we interact with different people, with different types of patients, with different backgrounds. So with effective communication, we can be able to deliver our service properly, and also we can do our quality care to patients. And it's really nice that we should possess the ability to communicate well, since in that way we can care for our patients, and it is also actually healing for them, not only physically but also in their emotional and mental health.
I do agree. How about you, Nurse Jella? How has the role of communication influenced you before as a nursing student? Paano tinapekto ng pag sasalita ng maayos ang your profession now in COD?
So communication is really essential in our line of work. So it is very important to learn verbal and non-verbal cues to understand the patient better and to show empath and yeah. Right?
Yeah, right. Okay, how about you, Nurse Gwen? How does the role of communication help you throughout this profession?
I think overall it helps us, me as nurses, do our job more efficiently, and also it helps us avoid committing mistakes, since communication allows us to communicate with each other, and I think that's something that makes us do our job more efficiently. Since if we don't communicate that well, we're more prone to misunderstanding things, like for example when we give our our patients' medication. Usually, if we don't communicate well, we are more prone to giving them the wrong medicine and stuff. So, communication really does help us do our job more efficiently.
Okay. So thank you for your responses, your comments. So generally for me, so the communication is really an important aspect in our daily life. So without communication, there wouldn't be any working or like mga nagpapatuloy na mga yeah, nagpapatuloy ng mga like working process on anything that we are handling in our daily life. So like we need to work on with our communication process. So like if you're not going to handle yourself, the way you talk, the way you handle your body language, or like it would lead to misunderstanding. So generally, not just in our profession, but in our daily lives, we must maintain a good and healthy communication to any communicators that we are communicating to. So thank you for your responses. So we are now going to proceed with techniques for effective communication. So before that, there are 4 main types of the role of communication in our society or in our profession. So 4 main types, general types would be the verbal, non-verbal, written, and electronic. So in the verbal, we are talking verbally with words like what we are doing now, diba? And then we are also talking in non-verbal. In this aspect, we are using our body language, our sign languages, symbols, and there are also a type like a written type of communication. We are writing or like subtitles like like that, and kuan. And then lastly, electronic. We are in this generation, electronics are mostly used in communication like online messaging or calls. Then we are going to proceed with techniques for effective communication. So there are several keys for effective communication, guys. So we are going to master, first, we're going to master active listening. So this means we are truly focusing on what the speaker says and what the respondent replies to. Then we have also empathy and compassion. This aspect, we are going to have sympathy, empathy to our patients, or not just our patients, but to our the people that we are talking to. So we are going to master that. So next, we have also a patient-centered communication. In this key factor, we are focusing on the patient's needs and preferences. So in general, we are focusing on the patient only. So patient-centered says much that nonverbal communication, a smile, eye contact, or body language is also a key factor to effective communication. And also we have effective team communication. Then effective team communication involves you and your team communicating effectively so we can provide effective and safe patient care. So what are your key takes on this, Jody?
So for me, those techniques are, there should be like in your character, those are the mixture of those techniques. So it is really impactful when you deal with your patients. Like imagine if you were in the shoes of the patients. Like, diba? Like if you're in the shoes of the patients, you would understand how important it is that we, as nurses, we should practice the active listening. Because when you're the patient and you feel like you're not being heard, it's different on their part. And also it could be a factor that could affect their health in a negative manner. And I think that's something that I have observed throughout my services in healthcare. And then also showing empathy and compassion. It's not that hard actually to be kind to patients.
Yes.
Like there are times that we have hectic schedules, we have a lot of case studies, and we have a lot of paperwork. But that doesn't mean that we have to be actually objective in our job. We don't have to meddle our feelings inside our job. So like when we face our patients, even though we are not having the best day, we have to appear to them with a smile and to show them empathy and compassion, because they are dealing with their lowest point of their life, and then I think that's very important. And also, patient-centered communication. Of course, you don't have to focus on yourself. So you have to look at the, the lenses of the patient. I'm sorry. Then after that, is the non-verbal communication. So there are, as they said, diba, actions speak louder than words. And like, there are non-verbal communications that you have to look out for because some patients actually lie. Like I could actually attest to that because some patients actually lie, and like you have to take note of the nonverbal cues in order for you to give quality care. And then effective team communication. So we're a team. We're a team.
Damn right.
Yeah, we're a team. So like we have to have the chemistry. We have to have
chemistry.
Yeah, we have to have
True,
the chemistry so that we can be able to provide quality care to our patients. So I think that should be something that we have.
Yes,
Those
that's
techniques
it.
are a mixture inside your communication skills
Okay.
in order to provide quality care.
Absolutely. What about you? What's your takeaway on this, Nurse Gwen?
Nurse Gwen is actually very delighted to share.
Yeah,
I can see, right? She's smiling. She's smiling.
She's smiling, so she
I feel like
empathy.
Yes.
Actually, I have nothing more left to say because Nurse Jody already said everything that I've been, that was on my mind before, prior to her talking.
Okay.
But I think all these factors are very important for us to achieve, effective communication in our workplace. And also, all of this are just like, it is also these are very important key points that we should take on because this is very important, for us to have this deep, because it is very important for us to have this deep connection with our patient also, for us to understand them more, for us to cater more of their needs. So we must be able to understand our patients, and we must be able to talk to them like casual talks and that, because with that they'd be more comfortable sharing how they feel, what they think, and stuffs like that. And I think with effective communication, they'd be able to they'd be less shy about opening up about their needs and stuff. So so all of these factors are very important for us to have
But
this
like,
effective
guys, have you
communication.
noticed that even with this communication techniques, there are still barriers of communication. So I want to talk about barriers of communication and like
We will-
I want to talk about the
Okay.
I want to talk about our experiences. So I want you to ask.
Okay, I would ask you, like, what type of barrier have you experienced before? Because since you've brought it up, you must have had a severe experience since it's very dulit sa imo.
Okay, so for me, I think the greatest barrier that I have ever encountered in my years of service is probably emotional barriers, like anxiety or stress, because especially when I was in the emergency room, like I was assigned on the emergency room, because the setting there is different from the wards, the operating room. It's very different because it is fast paced, and there are a lot of emotions scattered on that room. Like, a lot of patients are, they need urgent care.
Yeah. So
And-
how did you deal with it?
I actually dealt with it. At first it didn't come easy because, you just have to adapt to it, and that's how I dealt with it. I have to be the bigger person because there are other patients, especially their families, would scream at you for no reason at all. That's because That's because of their emotions during that time, and I feel like we shouldn't blame them. Like as nurses, we have to play the bigger. We have to play the role of being the bigger person. Yes, because we have to be. We have to understand their point of view. We have to understand their point of
Yeah.
view, and I think that's the biggest challenge to me. No, I have encountered a lot of barriers actually in my years of service, but to me, emotional barriers are really hard to handle, and I'm also at the process of working on it.
Okay, how about you guys? What type of barriers have you encountered? Nurse, Nurse Jella?
I think one barrier that's also very that's also very that also affects our communication is the ethnical barrier, you know, because since
yeah.
we all grew up from different families, different background, different places, so we all have different beliefs when it comes to approach on things. And I think so there are times, you know, that a patient would come in the hospital, and then you know, they come from different backgrounds, and they have different beliefs, and they have also different approach to how medication is being given to them. And the difficult part in this one is most of them would believe that, for example, the doctor would prescribe that a certain medication would be given to that patient, but since you know,
That's against
yeah,
your...
it could be like that. It could be like against sa kanila.
It's contraindicated by
Yeah.
their beliefs. Yeah.
Contraindicated by their beliefs. So they would usually, you know, they would usually say no. They would
Which would push
Yeah.
you to making alternative solutions and
so
like
it's-
approaches.
yeah. So that's also very hard for us, you know, because since they have different beliefs, but that's also something that we should understand, and we should be gentle about. We should be gentle. We should on taking that thing, because that's not their fault. Yeah, they are patients, so we should be able to understand
patient
them
on
and
your
be
patient.
patient. Yes, absolutely.
Be patient.
Be patient on your patient.
But guys, prevention is better than cure. So always, always keep yourselves healthy. Okay, kulangan lang sa
Yes.
And
we are so
alcohol.
kulang in our healthcare system.
We are health promoters.
Yes.
So that's the difficult part, you know.
Okay.
So how you communicate to your patient with different backgrounds. You know,
What
so
about
that they
you,
understand.
Nurse Jella?
So the barrier is noise barrier, since especially in these hospitals that are very busy, there it is very noisy, and you cannot communicate and hear your patients clearly. So it is very, to overcome this, you need ensure a quiet environment, and then
Yeah.
Damn,
right?
Thank you guys for sharing your most deepest experiences. So we are going to move forward but I am going to enlist some common barriers that are usually seen or like experienced in our profession. So some barriers could be language differences, so like the languages, some ethnic languages, or like languages from foreign languages. Then hearing impairments, there are patients that cannot really hear, so we are trying our best to we're trying our best para intindihan sila. So then we also have distractions. So there are distractions since the hospital is really a busy area. Then also emotional barriers, like Jody have mentioned earlier, like anxiety or stress. So to overcome these barriers, we are going to, in language differences, we are going to use interpreters, or trying to communicate much effectively with trying to slowly understand the patient. Then in hearing impairments, we are going to listen to them. We are going to talk to them in a quiet environment, and then to according to distractions, we are going to ensure that we are focused on the patient only. And then emotional barriers, we are going to be patient and Also, try active listening and try not to get too much attached to our patients. So, because we are professional nurses, so by addressing these barriers, we are making sure that our messages are clearly heard and clearly interpreted by our patients, so we can provide effective patient care. So next, we are going to proceed with real life applications and case studies. So I am going to present these two real-life examples. So guys, listen. First, a nurse who listens carefully to a patient's concerns about medication by clarifying and reassuring the patient follows the treatment plan and recovers well. Okay, so yeah. Then next, okay, we have imagine a poor communication. Rushed explanation leads to a medication error. So the patient becomes anxious, then and recovery is delayed. So these stories show how communication can mean the difference between positive and negative outcomes. So these two stories are very different, since the first story was a positive outcome with a effective communication. Meanwhile, the second story came out very negative, so it had a poor communication with poor results to medication to our patient. So I have a quote here saying that nurses are the bridge between patients and healing. So your words can be the first step in the journey. So thank you so much everyone for coming over. Thank you Nurse Jody, Nurse Jella, and Nurse Gwen, and thank you guys for listening. So this is me, Nurse Julia, peacing out. Bye. Thanks so much.